Good afternoon, and welcome to our series of webinars focused on bringing you information about COVID-19, infection control, and other nursing home-related topics. The information in these weekly webinars is geared toward long-term care and skilled nursing facilities, but we encourage everyone who's interested to attend. My name is Kathy Caudill. I'm a communications specialist with Quality Insights. Today's webinar topic is Quality Insights QIN-QIO updates, and this is the final webinar in this weekly series. Everyone has entered today's meeting on mute, but we'll have a Q&A following the presentation. If you have questions or comments, please submit them using either the chat or the Q&A tool in your Zoom menu. And now I'd like to introduce our speakers today, Penny Imes and Deborah Wright from our nursing home team. Penny Imes is a quality improvement specialist at Quality Insights. She started her nursing career in acute care before moving into long-term care. Her positions in long-term care have included staff development, dementia unit manager, registered nurse assessment coordinator, and director of nursing. She found the perfect combination for herself at Quality Insights, where she's able to work in quality improvement with long-term care nursing homes. Deborah Wright is also a quality improvement specialist at Quality Insights. She joined the team after being in long-term care industry for more than 30 years. She has a wealth of experience in long-term care nursing management, ranging from certified nursing assistant to vice president of healthcare operations. She's most passionate when working with the MDS process and quality improvement. Penny and Deborah, thank you both for joining us today.
Thanks, Kathy. And this will probably be one of the shortest Wednesday webinars that we've ever had, but we wanted to take an opportunity to come together with all of you. And as I can see from the participant list, there are many of you are those people who have been dedicated and loyal about attending these Wednesday webinars. And so, although emails have gone out from all of us, we felt that it was really important for the nursing home team to come together to speak with all of you and to thank you for your time and your dedication. As most of you know, we previously announced that Quality Insights has an extended contract for West Virginia and Pennsylvania that's slated to end Friday, March 7th. At this point in time, we have received no updates from CMS. And so we're looking at this, as Kathy said, being our last webinar. Besides attending the webinars, you've been dedicated participants in the quality improvement work. And we really do thank you for your participation over the last 5 years. A crazy 5 years that it has been. I've been with Quality Insights for quite a while, and I don't think any of us in long-term care have ever lived through anything quite like the last 5 years. So we really appreciate all that you've done, your dedication to your residents. It's been just a pleasure for all of us getting to know you. And, just a recap of some of the things that we worked on together, the opioid reduction strategy and work groups, nursing homes who worked very hard at meeting goals and being able to reduce those opioids, the hospital readmission work groups that we had, those of you who were willing to join the Nursing Home 5 Diamond educational platform. Some of you were our test pilots for that platform. Those of you who collaborated with us with real-time medical solutions so that we could look at best ways to get real-time data. Those Vivint Health Infection Control educational trainings that you participated in. And just all the times we reached out to you for your COVID outbreaks, your vaccination, are your COVID vaccinations up to date? And why are you still here? And what are your plans? And everybody just very graciously worked with us and participated. So we really enjoyed the time to get to know you. Your participation in some of our regional nursing home meetings where you were open about sharing your challenges and successes. And while our future is uncertain after March 7th, we will continue to offer resources, podcasts, and blogs on the Quality Insights website. Just wanted to let you know that it will no longer be reviewed or updated past March 7th. And Deb's actually going to take a few minutes to go over the website and these resources with you, just so that you know that they are still there for you at this point in time. So Deb, if you want to go ahead and do that.
Yep, thank you. So let me move the toolbar here out of the way. So the easiest way to get to it is here is the link, and Kathy can drop that in the chat. Also, a lot of times what I do is I just Google Quality Insights resources and it brings you right to this page. So this is the landing page for the resources, and you can come down and no, I'm not in the right spot. Sorry. There you go. You can search if you're looking for something particular. So if we search for immunizations, everything that has to do with immunizations will come up. You can see our most current pneumococcal algorithm that is up to date as of today. Like Penny said, everything will be as up to date as we possibly can make it for March 7th. But after March 7th, the resources will not be updated until there's more information regarding the contract work. Other resources that are available, if you go to multimedia, here's where you can find all of our podcasts with Dr. Storm. This is one place. I'll show you another place where you can get them, as well as all of our archived webinars. So all of the Wednesday webinars are going to be here. You can watch the recording. If there were slides, you can download the slides, the transcript. But this is a great place to come. I'm going to use the water management. That seems to be a hot one that people have been asking me for. So you'll still have access to that water management. You can share that with the appropriate staff at your facility to help ensure that you have the safe water management. But all the webinars that we've done are here. Another place that you can get Dr. Storm's podcast is under resources, Taking Healthcare by Storm. This you can do a lot of different things, where the previous website previous screen just had the most recent ones. Here you'll have the most recent ones, but then you can also go by topic, find other podcasts that she's done, subcategories, see what's underneath there. But then also, if you have any topic ideas or guest suggestions for Dr. Storm, you can fill this out and send to her, and she will be in touch with either you or the person that you're recommending for the podcast and submit that. So all of the resources that we currently have will still be available. They just won't be updated at this point. So if anybody has any questions on the website, we'll be happy to answer those either here, or you can email any of us through Friday.
And I would like to mention, as far as the podcast and Quality Insights as a company itself out of West Virginia, Quality Insights does continue to have ongoing state and VA contracts. Dr. Storm is part of Quality Insights, so her podcast will continue. So Quality Insights that's completed as of March 7th is the Quality Improvement Network, Quality Improvement Organization piece of it. And so the work that we have done with you as quality improvement specialists, that is what ends on March 7th. And, as we know more about the future of the quality improvement organizations, we will certainly let everybody know, update them. We don't have all the answers right now, but anything that we do know, we will definitely want to share with you. And actually, if anybody on the nursing home team wants to share anything, please feel free to do that. And if not, then we will just open this up to questions from all of you. I don't know, Patty, Jennifer, Shirley. It's a great nursing home team. So I
Well,
think Patty, you want to say something?
Penny, you know I can't let my last opportunity on a webinar go without having something to say, right? And it occurred to me as you were talking that while we have been a very small part of your lives as nursing homes, you have been a very big part of our lives as quality improvement specialists. And I don't think that there is a way for me to express to you what that's felt like in so many different circumstances. Just like every job, there are parts of your job that you really don't like. I did not like sending multiple emails out to you guys asking about vaccination rates. I can say it, didn't like it. But what I did really love and want to thank you personally for is for those facilities that allowed me to become part of your team, your IDT team, and actually function as part of your QAPI process and problem-solving process. I appreciated it so much. And all the lessons that I learned from you, being able to share that with other people in both Pennsylvania and West Virginia was really one of the most rewarding parts of this job. So I truly appreciate the way that you all have helped me grow as a nurse. And I really hope that in the future, we get the chance to continue that relationship. So hopefully you'll hear more from us soon. And again, just thank you from my heart.
Hey, Penny, you're on mute.
Thanks, Patty. I appreciate it. And if anybody does have any questions, please feel free to type them into chat, ask a question, raise your hand. And thank you for your thank yous. That was our main reason for having these weekly webinars, was to try to get useful information out to you, and we do appreciate that you appreciate it. So if anyone does have questions, please feel free to ask. We'll answer what we can.
Thank you, Penny.
And if not, go, Kathy, you were gonna say some things.
I was just going to do my usual wrap up, but it's going to be shorter than usual. I was just going to say, if anyone has a question, you can put it in the chat or the Q&A at this time. You could also raise your hand if you'd like to ask your question out loud to request to be unmuted. And normally I would plug our newsletter, but that's ending too. Our last one went out last Friday. So that will be ending at this time. We also let you know inside that newsletter. And I think that's it. Got some thank yous in the chat. Thank you all. Thank you for your thank yous.
Yes, and we do hope to see all of you again. I've said in long-term care, people cross paths over and over and over again. I've seen that many times over the years, so I'm sure we will, in one way or another, eventually cross paths at some time. No evaluations to do this time, right, Kathy?
I mean, I actually left it up there. So I think if anybody they want to evaluate today's webinar, please do so. I guess
Well,
the final question, I think, asked for like future topics. I'm not sure if that's relevant anymore.
yeah.
No, but it's still in there. So you might see that as a pop-up when the webinar ends.
Some thank yous. We really appreciate it. We really have, and as Patty said, we know sometimes we may have been that thorn in your side over the years, asking for things, for data, for information, but we really have enjoyed partnering with all of you and offering you the resources and education that we could assist you with. I don't see any questions. I guess everybody knows we'll see what happens. So, but thank you all. We really appreciate it. And hopefully, as I said, we'll cross paths in the future.
All right, I'll go ahead and wrap us up. Thank you, Penny. And thank you, Deb. Before we sign off, as usual, I was going to ask for everybody to answer our short evaluation for today's webinar. It's anonymous and shows as a pop-up as the webinar ends. So if you have a couple minutes to fill that out, we would appreciate it. Penny and Deb, I'd like to thank you for speaking with us today. I'd like to thank all of you for joining us this week and at our other weekly webinars. And we wish you all well and hope we have the opportunity to work again in the future. And we wish you all a good rest of your week.